Hey, mamas, and welcome back to another episode of the Modern Moms Club podcast. So, I always talk about why it's so important to be organic and all natural during pregnancy and postpartum, and of course with our babies. So today I have with us the founder of Dr. Bright, Dr. Pune, and she is the founder and the creator of Dr. Bright. I guess this is toothpaste and toothbrushes, and she's going to tell us all about it today. So thank you so much for being here.
Thank you so much, Sandy, for having me.
Yeah, so we actually connected through Instagram, and it's so important. And I always tell my moms how really important it is to everything they put in their body from pregnancy and beyond, really, to have as all natural and all organic. So I would love for you to tell the moms a little bit about your company and how you guys got started.
Yeah, perfect. So me and my sister, she's a cancer surgeon and I'm a dentist of over 20 years. We kind of came together in 2015, and the reason why is because her son Logan at the time was 18 months old and he was eating toothpaste. And Paris thought, oh, it's really cute. But when she looked on the tube, it said, oh, if swallowed, call Department of Poison Control. And then that's when she called me and she's like, oh my God, this is very interesting because he's been eating toothpaste and this is very, very damaging. And I just don't want to deal with something that says call Department of Poison Control.
Yeah.
So then we looked, and I'm in my practice at the time, there were people that were asking me about ingredients, what's healthy, what is SLS, what is all these titanium dioxide and things like that. And I was like, oh my God, I went to one of the best dental schools, but I was never taught anything about ingredients. So that's when we kind of came together and saw what's in the space. We saw Tom's of Maine, which was the natural choice, but we looked at the ingredients, and unfortunately at that time, or a little bit earlier, Tom's of Maine was bought out by Colgate. So they had 90% or more Colgate ingredients. So what is good, and especially for moms and, pregnancy, one of the things that pregnant women deal with after pregnancy is pregnancy gingivitis, which means that their gums get very irritated, mouths get sore, the gums bleed, you just touch the gum. So it's really important to know what to use to help with that situation, not make it worse. So as a dentist, moms come to me all the time and ask, oh my God, I've never had this problem. I'm very good as far as my brushing habits and everything else. I'm a mom of two. When I was pregnant, I got the same thing. So it's very normal to have pregnancy gingivitis, it's hormonal. So it's very difficult to use products with alcohol and other chemicals that actually make that situation worse. And moms need to know, and pregnant women need to be aware. Unfortunately, in the US, we really have to read labels. So I highly suggest you kind of educate yourself as far as basic ingredients on what you're looking for when you are pregnant or nursing, or if you're even planning to get pregnant. And even, not even that, I mean, us females, we get gum disease and guys get heart disease. So it's just hormonal, and that's what happens. So that's when we kind of came together. We took away everything that's not healthy, including artificial sweeteners, colors, including titanium dioxide, which is what makes the toothpaste refrigerator white. Like that white toothpaste has that chemical in it, which is really toxic and bad. I'm so sorry, this phone is. And then the other thing is sulfates and SLS. That is it's an irritant to the gums and the mouth, and it causes sores. So those basic things, if women know about SLS, titanium dioxide, alcohol, and artificial sweeteners and colors, then everything else should be perfectly fine. So that's what we did. We brought everything healthy, took everything that's not working out, made it actually effective, and brought it into the market in 2015. And here we are, me and you, talking about the products.
Yes. Yeah. And, during pregnancy, it's like one of the main things that, your dentist will tell you, every single pregnancy app will tell you that, you have to be really, really good about brushing your teeth and your dental oral hygiene, because there's also like, you can't get a cavity filled while you're pregnant. You can't, do certain things when you're pregnant, and like making sure that you have extra attention on just your gum health, especially during pregnancy, is super important for mom to just know about and bring awareness to.
Yeah, absolutely. So everything that you put in your mouth is very important while pregnancy, because
Yeah.
I mean, when you are pregnant, from your bloodstream and inside your body, all the chemicals go into the baby too,
Yeah.
which you want to avoid. So I highly suggest no sulfates, anything that's cancer causing or anything that causes inflammation. You need to be very careful. Like carrageenan is a thickener that's found in many natural products and also in our yogurt and dairy products.
Yeah.
It's a thickener, and people think, oh, it's natural, so I'll use it or I'll eat it. But it really is an inflammatory agent, and it needs to be avoided. So a lot of natural products, including oral care products, they have carrageenan in them. And I suggest these are newest research to avoid. The other thing, which is a very, very bad chemical, is fluoride. Me as a dentist, I always thought fluoride or nothing. But recently, all the major research has shown that fluoride in the toothpaste is actually pointless. It is a very toxic chemical, and it accumulates in the body like lead. So you don't want to have any fluoride, in your daily products. It's
I
really
remember in it was like elementary school, they would have us do fluoride, like in class.
Yeah. So fluoride, in the amount that is present in our toothpaste now and the time that you take to actually brush your teeth, it's not effective as a remineralizer of your enamel. So, but in the amount that's present in the toothpaste, it could accumulate in the body, and we brush twice a day for 40, 50 years, right? So it needs to be avoided because it accumulates like lead and you can't get rid of it.
Yeah. So definitely want to stay away from that, period.
Yeah, sure. I mean, what people ask me, okay, so if I use a non-fluoridated toothpaste, how is it going to help me get rid of cavities? Okay, so you need to know that the number one thing that you can actually do to remove plaque, which causes cavity, is brushing and how you brush and how much time you spend brushing. So the mechanical action of removing plaque is a lot more powerful than what you are actually using. So I definitely recommend, it's been about a few years, research has shown that sonic toothbrushes are a whole lot better than just a regular toothbrush. So if you use a sonic toothbrush, it has a 2-minute timer, which you need 2 minutes to remove the plaque. And that's what I recommend. It does 300 times better job than just hand brushing. So I would suggest a great sonic toothbrush in combination with a toothpaste that doesn't have artificial sweeteners that break down in the mouth and does not cause any inflammation, or it doesn't have any cancerous ingredients. So you need to know from your mouth, it takes 6 minutes for all these chemicals to go into your bloodstream. It's even faster than your skin. So it's really, really important to know what you're putting in your mouth. Yep.
Definitely. So I want to talk a little bit about your products, because I have some of them here. So I have the Dr. Bright Mints. It says natural activated charcoal whitening toothpaste. I've got the Berrylicious. This I've been using with my son. So he's and I want to get into that a little bit later too, about brushing for your kids. And then I have the mint chip. So tell me and tell all the moms a little bit about, like, with the Berrylicious one. This says natural vitamin C toothpaste. These other ones say natural antioxidant whitening toothpaste. So how are these different? How are you able to make this product in the way that it is, in the form that it is, and still, have it with all the benefits and all of the things that you need in a toothpaste?
So we've done a lot of research and development. We spent at least 3 years developing the formulas. Now, all the other toothpaste in the market, you see that there's some with coconut oil. So you've heard of oil pulling maybe in the past.
Yeah.
Coconut oil alone doesn't do the job for you. You need to have coconut oil as part of the formula, but it can't be the whole thing. Or there are other products in the market that have charcoal. You've seen all these charcoal powder, charcoal toothpaste, but it's black. So me
Yeah.
as a dentist, I'm very concerned if my patients or my family uses a black toothpaste or powder all the time, because it could tattoo your gums permanently. It's
Wow.
very important for the ladies to know you're buying this product. Charcoal alone is not going to do anything. It is an adsorbent. It's better than baking soda, but alone it's not going to do anything. So what we did, me and Paris, and by the way, we formulate everything in-house and manufacture everything here to be able to be in control of the
Sure.
quality 100%.
Which is so, so
So,
important because you're not
yeah,
outsourcing to somewhere where you don't even know what they're putting in the products and the chemicals, all of that.
exactly. So we took a basic label and made it very innovative. One, this is the way our products are. You eat the entire tube of toothpaste, nothing bad will happen to
I
you.
mean, we
So
got mint chocolate chip here, so.
we made it edible. Like it's so safe for kids because you can't prevent kids swallowing toothpaste or mouthwash. So our Berrylicious is formulated. Adults can use it. It's an alternate to the regular mint flavor with vitamin C. Direct application of vitamin C. When you get the vitamin C in your mouth that touches the gums, it actually helps prevent gum inflammation and gut disease. So kids normally have that because of the habits, they don't brush well, or, their gums, are very irritated sometimes because of the stuff that they put in their mouth. So we have developed that to
Which
be very
sometimes you don't even know what they're putting in their mouth.
right, exactly. Yeah, exactly. So we built that to be very safe for kids and also fun to brush and also tasty so that they don't miss. Oh my God. So what you get with Crest and Colgate and other conventional toothpaste is a very sticky sweet because of the artificial sweeteners, candy-like product,
Yeah.
right? But with our toothpaste, you don't get that. We are the only company that uses stevia and monk fruit as a sweetener. Those are amazing sweeteners that don't break down in the mouth. So you get a lot of innovation with our products. I mean, we're not just a clean label, but we're very innovative and everything is there for a reason. Like our antioxidant toothpaste, the mint chip, it's got real cacao in it. So it has very high antioxidant property. And it's actually formulated with real chocolate flavor. So it's amazing. It's my daughter's favorite now.
Yeah.
And I'm just happy because I'm giving her something safe that she loves to brush with. And that's all we need as moms, right?
Yeah. Yeah.
And then the mint, I want to say something about our staple, the one that you just had in your hand.
Yeah.
Our mint whitening activated charcoal toothpaste. If you open that up, I don't know if you can, have you opened it?
I've used the berry.
Yeah, if you don't mind opening it, because I want to tell people about this. I told you about charcoal and how it is very beneficial in whitening teeth, and also it's an adsorbent, so it gets rid of bad breath. But if you squeeze that out a bit, squeeze the toothpaste out, I want people to see that that's not a black charcoal toothpaste. We have the only charcoal toothpaste in the market that's not black. So we use charcoal in the amounts that is actually necessary and helpful.
Yeah, it doesn't even look black to me. It's like
it's not black and it's not white. You see how it's not refrigerator white either because we don't use titanium dioxide. So whatever toothpaste that you buy and you squeeze it out and you see it's really white, it has that bad chemical in it.
Stay away from that.
Right. Stay away from that. And if it's really black, also stay away because it could tattoo. Yeah, it could tattoo your gums permanently and you can't get rid of it. Like your gums will turn black.
And the crazy thing to me is that this is even allowed on the market. Like these products that are even, and this is the whole another topic of conversation, but the fact that like this is allowed on our shelves and something that's sold to us and it's approved by the FDA and they say, yes, this is okay for you and your kids and your family. Like that's the crazy thing.
And Sandy, you're absolutely right. When these companies go to Europe, they have to reformulate their products for European market because there's so many ingredients that are banned in the European market. I mean, on the other hand, in the US, nothing is banned.
We're the worst.
Yeah, we have to police ourselves. Even, I mean, as far as food is concerned, like our cereals, our meat, our chicken, everything that we buy. So we need to really know and be educated. What are we looking for? We're not looking for chemicals because
And don't be
that's
blindsided. You're not be blindsided. Don't be blind to the fact that because it's being sold and it has natural or a word on there that seems like, oh, this would be safe. Like do your research as a mother.
Absolutely. Absolutely. And one more thing that is very important. So sulfates cause the foaminess of a product. So when you use a shampoo that's got sulfates in it,
Yes.
it actually makes foam. And it's a toothpaste that's got sulfate in it, it makes it foam. So our toothpaste is naturally low foaming. So at the beginning, if somebody is used to the conventional foaminess, it is going to take a while to get used to the non-foamy toothpaste. But when you get used to it, you will never go back. So that's something that is maybe a challenge. I just want to be upfront. It was a challenge for me with hair shampoo. I mean, for a while I was like, wait a minute, is my hair getting clean? Yeah. But it's just an illusion that you get with the foam of clean. It's not really true clean. So foam belongs to when you want to wash your car and stuff, the chemical foam. You don't want to put it in your mouth. You don't want to put it on your skin, and you certainly don't want to put it in your scalp, on your hair. Yep. So that's really important. So sulfate-free, fluoride-free, and try as much as possible with sorbitol and things like that are artificial sweeteners. Stay away from sorbitol, artificial colors. When you see, my daughter grew up, because I had no idea, right? I'm a dentist. My husband's a dentist. So don't feel bad, you guys. Yeah, don't feel bad because you guys don't know, but I don't know, right? She grew up using Crest or Colgate Kids sparkly toothpaste. She loved it.
Oh, yeah, I remember using that too with the little mermaid toothbrushes and like the sparkles.
Right. Those sparkle things, then later on I found out, oh my God, so bad. Or the mica and stuff that they use and the micro beads and things like that. So the artificial sweeteners actually caused her to have a cavity at age 5. And I was going crazy because I brushed her teeth every day.
You're like, but I'm doing everything right.
What have I done? So ever since then, she's never had a cavity. She's been using our toothpaste now for over 2 years. She just had a cleaning at our dental office. And my hygienist is like, this is the reason why I love Dr. Bright products. Her gums were healthy. We took x-rays, no cavities. So, I mean, that's what you want. You want a product that you can trust so that it actually betters your health instead of giving you problems.
And it's also creating those habits for your kids like early on. Like for my son, we started, and I want to get into this too, but we started with the little finger, the little clear, it's like a little clear thing you put on your finger, and it's got the little, not even bristles. It's like, I don't, what do you call that? It's like I don't know. I should go get it. But it's like a little scrubber, it's a little scrubber you put on your finger and you brush. And I would just use water before I actually got your product. All I was using was water on there and just a little brush. And he loves his toothbrush. He sees us brush our teeth in the morning. He wants to jump in. So I got him a toothbrush. But I want to ask you, for all the moms out there, at what age do you start brushing your kids' gums and teeth?
So you brought up a very good point. As soon as they have their first tooth in their mouth, you need to get one of those finger brushes because those are very gentle to the gums. Don't get a toothbrush. That's still too early. So as soon as they have their first tooth, meaning between the ages of maybe 7 months to 10 or 11 months, you start using those brushes. And you did the right thing. Instead of using those artificially sweetened toothpaste, you use water, which is the right. I'd rather do that than to use those. But now that you have a safe product to use, you would incorporate it because it gives them more, right? So
now that I have yours, actually, I didn't do any toothpaste until I got this. So now we do this. And it was funny. The first time he did it, he was like, and then now when he goes to brush his teeth, he's like,
So so it's you use that and you put it on, and you actually, when they only have 1 or 2 teeth or they're getting their teeth, you want to massage their gums too.
It's comforting to him, I can tell.
Right. If you massage the gums, it circulates blood in the gums, it reduces gum inflammation, gets rid of all the bad stuff in the gums, right? And then when they're about maybe ages of 1.5 to 2, you start transitioning to a hand brush. Now, I said sonic toothbrushes are great, But sonic toothbrushes need to wait till a child has almost all of their permanent teeth. Not all, but I would suggest at age 7. At age 7, they're in a mixed dentition, meaning they have both permanent teeth and some of their baby teeth.
Okay.
So at age 7, a kid can hold the toothbrush in their mouth and move it from side to side. So up to the age 7, you have to buy and make sure it's soft bristle toothbrush. I have no idea. I just, as a dentist, it drives me nuts that people still sell hard bristle or medium bristle brushes.
Yeah, I don't think I've ever bought that. I think I've always gone with the soft bristles.
Yeah, but I've seen it in drugstores. I've seen it in, in grocery stores.
Yeah.
At a medium bristle toothbrush. I tell all my patients, listen, you use that to scrub your bathroom floor or clean, not in your mouth.
Clean the tiles, not your teeth.
Yeah, exactly. You don't want to use, you want to use soft bristles and you want to be gentle. You don't want to get it to be, hard. I mean, if the bristles flare out, it means you're doing it too hard.
Yeah. Got it. Okay. So, all right.
And then did you get that spray? Do you have that gum spray?
I do. I have it. It's in his room. He's sleeping, so
awesome.
It's in his room.
So I was going to say something about that. So our kids' product consists of a toothpaste and a spray mouthwash. And that spray mouthwash is amazing.
Yeah. Tell us about that.
Yeah, if they're little, you do it for them, about 4 or 5 sprays, and then they swish around and spit out. Now, we created a spray because we didn't want them to swallow, even though it's safe, but it's not going to be effective if they just swallow the product.
Yeah.
So this, right where the gum and the tooth meet, and you spray it in their mouth, it makes their mouth healthy and also their breath fresh. And because it tastes good, they love it. So you do that in the morning and you do it at night.
So how soon do you want to do the spray? Like at what age?
I would start at age 2, as soon as they have some teeth in their mouth.
Okay, so then Jake is a little too early for that because he's almost 17 months.
Yeah. So some kids, their growth spurts and their teeth coming in.
They're popping in like crazy now. I mean, he went from not having any to boom, 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 like they're all over now.
So I would say as soon as you see molars in the back, you open their mouth. And when you do see molars in the back, start using the spray. It's safe enough.
So then we're good. Okay. Okay.
Perfect.
Good. So then would you use the spray and the toothpaste? Would you use both or one or the other?
No, you use both. You do the toothpaste first, and then you use the spray. And I prefer for that good stuff to stay in their mouth for 30 minutes before you give them some water or milk or whatever they drink. So then, it would be perfect to do it and wait about maybe 20 to 30 minutes before they eat or drink.
Okay, perfect. So
all that good stuff will go into their gums.
What else does mom need to know? If she's looking for, to get the right toothpaste, to do the right thing for herself during pregnancy and then after, so we talked about getting the right brush, right? So we have the automatic brush instead of the knife. We talked about having the right toothpaste. What else can she do to prevent that pregnancy gingivitis, all the things that we don't want, but we know we're faced with during pregnancy. And then of course for our little ones, once they start getting their teeth.
It's basically pretty simple. You do what you normally do, which is the twice a day brushing. Okay. But then I would say, even though if somebody is not a mouthwash user, if they are pregnant and use the right mouthwash, not any like Listerine and things like that have so much alcohol and chemicals that cause even more problems. So our mouthwash has aloe vera and coconut oil, neem oil. It's just an amazing soothing mouthwash. If you use something like that, let's say you remember how aloe vera, like when we were kids, I remember my grandma, I had a scrape and she's like, oh, rub aloe vera on it.
Yeah, my mom had a plant. Yeah.
Yeah, exactly. So aloe vera is very good for the oral health as well. It actually hydrates and soothes the gums. So if a product has aloe vera in it as a base and doesn't have alcohol, because alcohol causes dryness of the mouth, right?
Yeah.
So no, you don't want to use alcohol because it's going to
also linked to throat cancer as well.
Yes. I mean, you rinse with alcohol every day. You're gonna cause harm to your body, right? Yeah. So when I was going to dental school, all these companies, they send you boxes of products. So I had no idea that these are not good. So
Yeah.
when I graduated dental school and had my own dental office, they still did the same thing. So I would let my patients grab one, and take it home. We had no idea. Now that I know, I don't go close to those scope, Listerine, things like that. They're all Poloxamer 407, which is a man-made glycerin type of a thing, right? So you don't want
Yeah.
any Poloxamer 407, no alcohol. So, yeah, rinse with a aloe vera based mouthwash, right? Ours has charcoal in it. People that can't, like they have, sometimes, pregnancy causes uh, acid reflux. Like I had
Yes.
very bad, right?
Me
I had
too.
to
Me
use
too. That was
Tums
one
all
of
the
my,
time.
yeah, acid reflux. Well, not
Yeah,
acid, heartburn was what I had. Heartburn, like
heartburn.
so bad.
Exactly, heartburn. Right. So it causes heartburn, and if you actually rinse with alcohol-based product, it makes the heartburn worse. But if you use a product that has a little charcoal in it also, and it's aloe vera and coconut oil, it is so soothing. My patients come back to me and say they're 7, 8 months pregnant. They're like, oh my God, this has taken care of my heartburn too.
Okay, game
No?
changer. Okay, thank God I have this for the next time.
Yeah, because I mean,
just sign me up for like a whole bulk package for next
you,
time.
you know how charcoal, they give like charcoal rinses
Yeah,
to people, like when you're cleansing.
yeah,
So the charcoal calms down the stomach acids
yep.
and everything else. And so the charcoal in our product, in our
That's
mouthwash,
amazing.
actually does the same thing. Yeah, so it's great. So I would say just buy a Sonic toothbrush, whatever you do. We have a great one. You can check it out. It's a lot less expensive than Sonicare. It's very similar to Sonicare.
Yeah.
And buy a Sonic toothbrush, get good products that have good ingredients, and rinse with a good mouthwash at least twice a
Flossing,
day.
right? That's a big
And
one.
that should be it. Yep. I think it's amazing. You brush and then you rinse, and then again, don't eat or drink for 30 minutes. Let all that good stuff go in your gums. You
Good.
do it for about 20 days, 21 days, you'll see a big difference. Your
Wow.
mouth is not going to be sore. Yep.
That's so amazing. And yeah, I mean, I think a lot of people don't think about this until they're pregnant, because for me, I didn't start switching over to all natural products until I was pregnant. I mean, I was already eating organic, but that was my food. And then when I was pregnant, I was like, oh my God. I was texting my girlfriends, and I literally, my husband wanted to kill me. And one day I went on Amazon and I bought all new makeup, all new shampoo, all new lotion, everything organic, because, and toothpaste, because I was like, I can't have this in my body. Like it's such a huge change. And I know even for some women that are trying to get pregnant, this is a major thing as well. Switching over to products that are all natural, because it has to do with fertility. So it's all linked together, and it literally starts before pregnancy, and then therefore after, taking care of yourself and, now your baby.
Yeah, absolutely. There's hormone disruptors in the products that we use as well.
Yeah.
So it's somebody's not pregnant, but they're trying to get pregnant. And then people come and say, oh my God, US has the highest rate of not on pregnancy, like people that want to get pregnant and they can't get pregnant because of, infertility. It's because of all these things that we use and eat and put on our bodies. So yeah, absolutely. But I mean, you're absolutely right. When you are going to be a mom or you are pregnant, you really think about these stuff. But I wish everybody, like the millennials, people just graduating from school, they would think about it at an early age so that they're prepared when it's time for them to, get married and have kids and all that. So it all
I think
goes
bringing awareness to it is super important. What you're doing, what I'm doing here, and making it known, like, giving it a platform and saying, like, listen, it's not just about like brushing your teeth every day. Like, know what you're putting into your body and understand that it's creating like a ripple effect for everything else that's going on in your health, so that's super important. And I think all the moms, that listen to this podcast, they want this information. They want to know, like, how do I give my baby and my body, and my family, like, the best out there when I'm not putting toxins and chemicals and, they want the knowledge, they want the information. So it's definitely, it's needed and it's wanted.
absolutely. And people like you, it's amazing. I want to thank you because you are, creating an atmosphere, and you're bringing on speakers that are subject matter experts so that your audience can know about all these things.
Yeah.
So yeah, thank you for doing that.
Yeah. So where can all of the moms find you? I know we have a link that I'm going to put in the show notes for a page where they can link up and check out the toothpaste and all the products that you have. But where can they find you on social media and like across all platforms?
Yeah, so we are on Instagram at Dr. Bright Naturals, and we would love for you guys to follow us. We do post often, and we do a lot of stories, and they're very, very educational. So it's amazing. And then drbright.com, it's drbrite.com is where you can find our products. I'm always available too. If you want to shoot me an email, info@drbright.com. You will get firsthand anything that you want to ask me. If you want any kind of a second opinion on anything, I'm here to help out. If you have information or if you need information about any ingredients, I'm here to help out. So info@drbright.com or drbright.com is our website, and @drbrightnaturals is our Instagram handle.
Awesome. Well, thank you so much, Dr. Pounet. And I know that all the moms listening, like I said, I'm going to link your page, the website that you've actually given me to give to all the moms in the show notes. And listen, if you guys, moms, you guys are checking out the products, tag Dr. Bright in your post. I know what I'm going to do is now that we've done this podcast, as soon as I do Jakey's teeth tonight, I'm going to do a little post and share because he loves that. So I'll share with you the little video of him brushing his teeth because he loves to brush his teeth. He's so good. Like I said, he sees us doing it. So he thinks it's fun. He wants to like join in that. So so thank you so much for being here, sharing all your info and wisdom. And thank you for creating a product that us moms can trust for ourselves and our babies.
Thank you so much, Sandy. Thank you everybody for listening in, and hope I have given you a little bit of information of what to look for next time you guys are purchasing something for yourself or your family. Thank you.
Definitely. Thanks, mamas. We'll see you on the next episode.